health care. If you can't go anywhere else, you have to go to county. You know, there's just no choice. You go there, and for a long time, people just weren't given good care there because there was no money put into that place to keep it in the up to date in matter of technology and the equipment. And things are starting to change a little bit now. And essentially, hopefully, some part of what we did will make sure it never slips back to where it was before.
I have a somewhat divided attitude towards Cook County. I think that it's really terrible, you know, that conditions there are not what they are at Northwestern, or University of Chicago, or Loyola. These patients, by and large, need more health care, not less. They're sicker, not less sick than the people who get the finest health care.
Why are they sicker?
Kevin got into that a little bit when he said that people don't come to county until they're at the point where they just can't do anything. So they're so sick that they have to come into the hospital. Other folks, for whatever reason, you know, will be seeing a doctor when they just start to get sick. And it's part of preventive medicine that they're prevented from, they never reach it to a hospital because their disease is taken care of before it progresses to the point where they need hospitalization.
Patient comes into Northwestern, and the most important thing is you call up that patient's private attending physician down on the Gold Coast. And the guy says, oh, I know her. I've known her for 20 years. Here's the whole story, and she's got 5 problems, but this is the major one. This is the one you got to worry about because that's given us problems in the past, etc., etc. You get a whole profile of what's wrong with the patient. You work in the emergency room in county, the patient comes and says, Doctor, I've been short of breath for 6 months, period. And you have no information on what goes, you don't have his old record, but that's the least of it. That patient has not had any kind of personal attention, evaluation, follow-up, and care that you really have to have if you happen to have a serious illness.
We see people with major complicated illnesses that the average physician isn't going to know how to deal with. The complications of drug abuse, the infections that will hit the heart in a drug abuser, the problems of hyperactivity in lower class children. They're all shuttled into county, and we're prepared to deal with them. Some of us because we have a social perspective, some because we have a political perspective, and some because we're do-gooders. There's an amalgam of reasons. The fact of the matter is that I agree with Rob that as bad as county is, I want to see the patients come to county and not go to a hotel, not go to the Northwestern universities, whatever, because their chances at county are much better of being helped.
Because somebody has to stand up for those people that need that help, that need care, the right care. Somebody has to stand up for them, and it's about time that somebody did.